आता आज एक सुई देते ते घे. Completely azoospermia. Now this man, I've told him, I said, no matter how many women you marry, you'll never get any children. But he's very naughty. He gets women from other villages where the women don't know. About his condition. Now she's the second wife, but then he married recently another woman, and she became very depressed. And I said, you won't get any children. So she's the second wife. The first wife has no children. Now he has married a third woman.
Is there a lot of guys like that in the village that pull this kind of prank?
See, if there is sometimes some abnormality, we can cure it. See, if they come for infertility, the first thing I tell them is, now, call your husband, I'll talk to him. See, the husbands always think that the woman is always important. So I asked for the man to come. Then I explained to him that if you get your semen examined, it is easy. Suppose there is some little defect, and then we can give you a few injections. So they're very happy with injections. An injection means a miracle cure for them. See? So all of them, even if they've had a headache, they'll say, no injection. We send them out with just aspirin. So I said, all right, not this time, but suppose if you don't feel well, come next week, and then we'll see about the injection. So about these men who, see, then I have to explain them, they get their semen examined. If there's any defect, then we give them the treatment. If not, then I take care of the women. See?
But do they...
For infertility.
If they don't produce children, some men, they beat their wives, no?
No, they don't beat their wives, but they'll wait 5 or 6 years. Some of them will take them into town for treatment. Now that they know that there's a woman doctor here, most of them come to me from these surrounding villages.
What do you see now? You have the men have a sperm countdown?
Yes.
And if they're deficient, what do you give them? Testosterone?
Yes, testosterone.
Does that do anything?
It does help them. If there is a minor defect. But now for this instance, her husband is completely azoospermia. You really can't do anything for him. See, I've told her that. बरं आता खाली पाठच दूध मग काय तपास तुला
काय नाही
विकाल बराबर यायच्यासाठी मग काय ते मग कसं समजल कसं 1.5 महिन्याच्या नाही समजायचं 2-3 महिने झाल्यावर ये मग जर रिटर्न जर नाही आला मग 2-3 महिन्यांनी ये मग समजेल फक्त आता औषध घेऊन जा. So you just give a few pills for a backache. See, she says it may be psychological also because she says she's had 6 weeks amenorrhea. And I'm calling her after 15 days again because it's very difficult to know me just now. Except if you do the urine test or...
She thinks she's pregnant.
She thinks she's pregnant, but this has happened so many times.
Is she also hoping that she's pregnant? Hoping to...
Very much hoping, of course. Yes. मग 15 दिवसांनी ये मग समजा तितके 2 महिने होईल.
So what will happen in 15 days? What will you be checking for?
The uterus will be, I'll be able to feel it more. Say the 2 month size, but per abdomen you don't feel anything. काय बाबा इथं काय तुमचं? You want me to go around somewhere?
Not necessarily. No, we like to visit with your patients. How many of these people come a day?
Today we had about 75 cases, but the doctor finished most of the cases. With me it takes more time because I have to do pelvic examination. That takes a longer time. Rest house you should see, go there. Tomorrow you can all come again, no? बरं तुला काय आहे? He complains of pins and needles in hands and feet. And दुसरं काय होतं? आगाग उठलेली काय मला? Burning micturition.
Two separate problems.
Most of them come with this pins and needles in hands and feet. We give them B complex, injection plus the tablets plus B1.
Most of the
And sometimes niacin, yes. And for the burning micturition, we give mist alkaline mixture. See, I haven't got the facility to examine the urine, but in a couple of days, just change the pH of the urine.
You want to make it acid, right?
I make it alkaline from, if it may be most probably acid, and that gives the burning mixture.
Do you think she has an infection?
Yes, if she doesn't, within 2 days, if she doesn't respond to the alkaline mixture, then I give her an urinary antiseptic, some drug. Before that, I don't give it to her. Sometimes a herbal remedy, something mild, before I go to the stronger drugs.
What other signs would you have of vitamin B deficiency? That's B6 deficiency.
Usually they have this hyperpigmentation, this butterfly patch on the face. Even now, see, there is this hyperpigmentation, cheeks, see, all of it. But some women have it very marked, this butterfly patch on the face. And to improve the circulation, some peripheral circulation, I give them niacin. That also helps. Most of them require multiple vitamins, iron, B complex, niacin. Jai Baba Bernard, how are you?
Good. I like a few.
As you like. चला ते अल्कलाइन मिक्सची बाटली आणलेली आहे गेल्या वक्ताची बरं ते तिथं जाऊन ते सुई घे आता पण फरक आहे का नाही
That's funny. I would
Yes, that laboratory is very necessary, see, because we get lots of cases of urinary infection.
Why can't you just use a dipstick? You know, the dipsticks, they have this 7-8
I
fold
have it,
test on a
yes,
dipstick.
yes, I have it.
You know, they
Yes,
can tell
yes.
you.
So we have to give her.
That's right.
I'll arrange for that. Give her a container and make her pass the urine and do it. So, see, if I have extra help, then I can do it.
Yeah. Do you have a centrifuge? Do you have a centrifuge?
We had one centrifuge and the Salvation Army Hospital wanted it and I thought I'd never require it, so I gave it to it. A hand one. But we'll get things. Once we set up the laboratory, we'll get the things.
Microscope?
Microscope I have, yes. Microscope I have. But you see, we have to have a special room because already this place is crowded. So we have to have a room for a regular laboratory.
When do you plan to open that laboratory?
You get me the cement and we'll build it.
I'll do better than that. I'll get Glenn to mix it.
See, stains, we can borrow some from the Meher. Did you go to the Meher Center? What did you do there?
Well, we just watched how Bob Street uses homeopathy.
Ah, yes.
Very different. Very different experience.
See, the principle of their medication is quite different from, we treat symptomatically and what they'll do is give constitutional remedies, really speaking. And it's very good. Gets it out of your system completely. Ha, chal ja. Itha jaun sui hai. See, these people are getting impatient. हे 3 टाइम गोळी खायचे तिथं जाऊन सुई घे सुभाषला ते अल्कलाइन मिक्सचे ते डॉक्टरचं चालून गेलं
Will she come after
तुमचं
a few
बघायचं
days?
तुमचं तपासायचं
Got some more for
Yes, I have more patients, but I don't know what has happened to the other doctor. निर्मला कौन है? निर्मला सुंदर प्रभु ने निर्मला सुंदर प्रभु ने
निर्मला चला प्रभु ने शिकून या दाराने आता मैं भाई करते नका वाची चला बसून घ्या
पोटाचे आहे का तुम्ही हां किती महिने 4 महिने शी इज अ प्रीनेटल केस कितवा आहे लेकरू कितवा लेकरू आहे हे चौथा आहे पोटात 3 है शी इज पैरा 4 एमेनोरिया 4 months
She's 4 months now?
येस काय त्रास आहे 3 लेकरं जिवंत आहे वारलं लहान लेकरू किती वर्षाचं आहे शेवटचं लेकरू किती वर्षाचं आहे 1 वर्षाचं बरं आता त्रास काय होतो कुठे दाखवा इथं किती दिवस झाले परसकडलं होती बरं चल लघवी करून आले आता इथं झोपू इथं डोकं कर तिथं पाय सुभाष पडदा लाव विल जस्ट एक्झामिन थांब आता तू इथं डोकं कर बाई तिकडे पाय एक्झामिन हा लांग
Do you have a fetal scan?
ओव्हर देयर
What is her
over
problem?
there on the wall.
What is her basic problem?
She just got pain in lower abdomen. Just see if her heart, everything is alright. Just general checkup.
Sit up.
When you have a Western doctor come in like this and this woman is laying down, are they a little bit embarrassed about that? If he has to...
No, that's why I'm telling. They won't let them do a pelvic. They won't allow a man to do a pelvic examination, but just examining the lungs and heart. That's all that.
Yeah.
Because the doctor also examines them like that. पर्दा खोलून टाकून त्यांना काय फोटो घ्यायचा लक्ष्मीबाई भाऊसाहेब धवले
deep breath. Take a deep breath.
अरे श्वास घ्या असं जोराने श्वास घ्या just a quick examination to find out if there's anything abnormal
Deep breath.
काय त्रास आहे बाई तुला थांब बरं काय आता आहे पांढऱ्यामध्ये फरक पडला का नाही She was coming for white discharge but she's better now दुसरं काय आहे
एक दिवस जास्त होते एक दिवस कमी होते
बर दुसरं काय होतं लघवीच्या बरं आहेत हं See, I'm using and very effective.
You're treating her for vaginal discharge?
Yes.
Could be gonorrhea.
No, it is not that type. Gonorrhea, you can see, you can know it, no? Purulent discharge and all that. No, it's not that. I've done her examination before.
No pain.
No. Discharge which comes and goes. This is sometimes there, sometimes it's not there. But she's responding to this treatment that we are giving her. हे गोळी खायचे तिथं जाऊन सुई घे What is it?
I can't tell. Lungs are clear, heart's not.
Good.
She has no abdominal pain, so I don't.
हे औषध दिलेलं आहे गुरुवारी मग ये समजली का तिथं जाऊन सुई घेऊन टाक
Goher, is it because of sanitary conditions that a lot of these women have these problems?
Both sanitary, yes, and also due to disease.
Dr. Goher, should I come to say goodbye?
Yes.
Let's say goodbye and video for good.
And ताप ठंडी का
चला झाले 2-3 दिवस.
2-3 दिवस. एक दिवस आड येते का रोज येते? एक दिवस आड येते का रोज येते? ताप एक दिवस आड येते का रोज येते?
रोज नाही,
This आड. She has fever on alternate days.
Fever what?
On alternate days, mostly malaria.
Is there an infection coming on?
And she's complaining of pain here. The bus by Dr. Papa's place. The bus.
Chloroplast?
Yes.
2? Why? How about her? Is she getting injection?
You want her to sit up or do you want her to stand up?
This one feels really.
साडी बाजूला कर बाई खोकल्याचं तोंड असं फिरवायचं तोंडावर हात ठेवायचं. I'm so sorry, I'm not even saying Jai Baba to you. बरं तुला काय आहे सांग. काय आहे सांग. तू आता 2 महिन्यांनी आली हा कुठे गेली होती इतके दिवस. She comes here after 2 months. आता तो काय एक महिने कुठे इथं आहे आण.
Oh, you have to take envelopes, that's right. Is she getting an injection, Dora?
Yes.
What?
हाँ give a chloroquine
How
for.
about this one?
I'd love to see the flesh
कसा है
too.
बरं आहे का? दूध पितो का. अगं तर त्याला दिलं का काय. खोकं दादा असं घ्यायचं. थोडी सर्दी छाती गरम ठेवून ऐकलं का. आणि जुलाब होते. जुलाब होते.
नाही होते जुलाब.
No. You could which would be causing pain.
पोरगा आहे का पोरगी. पोरगा
हा दाखवायला तुम्ही
नाव काय.
ते म्हणले जे बाबा ठेवलं जे
जय बा.
That's his name?
She's very funny. She used to come to me when she was pregnant. And she says, I told her to give the name Jai Baba. I would never give that name. नको जय बाबा नको बाबा. त्याला असं ठेव मेहरनाथ नाही तर मेहरराम असं ठेव. हा जय बाबा नको. जय बाबा काही नाव नाही. जय बाबा जसं आपण नमस्ते करते तसं आहे. Some of them will call their children Baba Sahib. Why don't you sit down?
She's asking for a name, Dora? She's asking for a
No,
name?
I said, what have you named the child? And she said, Jai Baba. She said, I told her to give the name Jai Baba.
But what are you saying now? Name
Now
it
I'm saying Meher Ram or
That's a
Meher
good
Ram is
name,
better
Meher Ram.
because Ram and Meher.
Yeah, MeherBabaLibrary is good.
Meher Ram too. Jai Baba नको. Jai Baba काही नाव नाही है. Jai Baba काही.
She has seen it come.
Pardon?
Where's the thing?
I don't want to shoot too. I want a couple. Got these other jobs. More than one shot.
इथं दुखत होतं कधी दुखत होतं दाबल्यावर दुखत होतं श्वास घेतल्यावर दाबल्यावर श्वास घेतल्यावर नाही दुखत ना खोकला आहे का व्हेरी एअर
How about just go ahead and ask her about her back?
You want it in the renal area?
Yeah. This one?
Right knee, left knee. And here also, you see. But I know when you dress.
Yeah, well, she has a urinary tract problem, like pyelonephritis. Could she have brain urination or an infection in some other illnesses?
पाच सहा महिन्यापासून दुखतो आणि आता काय कोणत्या दवाखान्यात She's had now she's without registration. She's had this complaint since 5 or 6 months. कुठं कोणत्या दवाखान्यात गेली नाही दुसरं बाहेर नगरला गेली होती नाही कुठं कोणत्या दवाखान्यात खाजगी दवाखान्यात गेली दाखल केलं होतं तिकडे काय होतं दर वक्ताला असं थंडी वाजून टाक येत होती लघवीचं काय होतं का असं बोलले होतं तिकडचे डॉक्टर शी वॉज ऍडमिटेड इन सम हॉस्पिटल इन नागपूर शी डजंट नो वेअर आणि किती दिवस तिला She was there for 7 or 8 days. But you wanted to ask Barbara some questions?
Dr. Sui?
Barbara, that's Barbara. So we take it as urinary infection.
Does she have any vaginal discharge? Does she have? Could be a very
Yes. Blood pressure the and Subhash.
But she has symptoms of urinary infection. Go ahead.
Yes.
She has symptoms of urinary infection.
लघवी मध्ये आग होती जलजल होती मांगे
She does have brain.
So many doctors today and so many nurses today. You should really train these people who are working there because none of them is a trained person. No, why I say it because I don't have so much time to go over every time and check on them as to how they're doing it. But if you guided them, because you're here for a short time, but then see if you guide them, if you teach them the right method. Sometimes if I have time, I do go over to Sindhu's number, except for the 2 doctors, that doctor and myself actually. Yeah, we don't have trained staff here. There's nobody here. Not a trained nurse, nobody. Then it goes a bit difficult with me. भागीरथी ना कमर दुखती दुसरं काय होतं
2 महिने झाले पाळी
डॉक्टर तू केस पेपर काढलाय का हां ह्याचं काढलेलं आहे ना तुझ्या मग डॉक्टर बघ हां मेहर हां दॅट आय विल डू वन्स दिस
हे
दाखवलं ना झालेलं आहे ना मग काय मला माहिती
नाही ते म्हणले
हां हां तर बरं आता तुला काय कंबर दुखते दुसरं काय होतं
2 महिने पाळी
त्याच्या आधी येत होतं पण त्याला लेकरला दूध पाहिजे मग तसंच होईल दिवस गेलेले असं वाटतं 6 महिने दिवस गेलेले
दिवस नाही गेले.
What is it? They are always very, except for I thought maybe due to urinary infection. Yes. आता तुला खाली सक्तीची सुई देते विटालियाच्या देव औषध. See, I use these herbal pills for all gynec complaints. See, this is for primary, secondary, amenorrhea and all. It's very good. These are all very effective. Only when they don't act, then I give them the hormone treatment and all. Amenorrhea, 2 months. But she's nursing the baby, and they won't listen to it. She had a period, even when she's nursing, she had a period 2 months ago, but now she wants it regularly. If I tell them, they won't believe it. हे विटाली याच्यासाठी आहे. हे 3 टाइम खायचे सकाळी दुपारी संध्याकाळी. त्याच्या बरोबर then I give them, you see, calcium, because they never drink milk or anything. Babru, you going? Hey Babra. कमर लई दुखती ना, तर जेव्हा दुखली तेव्हा एक गोळी खायची. हे कमरच्यासाठी बरं नाही वाटलं तर मग. आणि शक्तीचे देव का नाही तुम्हाला लोकला शक्तीची लई जरूर आहे. हे सकाळी संध्याकाळी खायचं. तुझं नाव काय? लानूबाई. Why don't you sit down?
No, I've been sitting down all day. I'm more comfortable to stand.
आता दवा आविष्ताने माती सुजोय આગળ કરું એટલે સોરી
ચવન પ્રસ્ત તે અર્ણવને આપી દેવાનું છે. આજે મોકલી આપશો. હા તંદે.
આ રોગની સલ્તાને જે પેન્ડુન આપવાનું છે.
હા
ના આપણે દીવોની છે તંદે લેફ્ટરને ક્લોસામ એટલે 4 ગોળી જ છે ખાલી તમામ.
We had a very difficult case of tapeworms, and that man.
She has.
No, we had one case. Not very common though. I think it's more common amongst Mohammedans, because there must be beef, because Mohammedans eat beef. The Hindus don't eat beef. He was a Mohammedan and he took a lot of treatment outside in private, but nothing helped. Now this time I'm trying this on him. So let's see. He'll come now next.
What's the name of the medicine?
Niclosamide.
I wonder what the generic. Oh.
And they say this is effective on all types of tapeworms.
You found a case of tapeworm? Was that, you had a case of tapeworm?
Yes. He'll come next week probably, most probably.
In the stool or what? Did you diagnose it in the stool?
What's the stool diagnosis?
How did you diagnose the tapeworm?
Oh, he brought and showed me the tapes.
Showed you the wound.
So now let's see if the head must come out, because he said he's been taking treatment for the last 2 years from various doctors in town, but hasn't helped him at all. So now I changed this and let's see if it is. See the pylon. Give that one. तिथं जाऊन एक सुई घे.
This is the same girl.
Yes, left. She's tender left renal angle, no?
Don't come to बाबांचा आशीर्वाद.
left,
बाबांचा आशीर्वाद.
Yeah, right.
असं एरिया
left.
आम्ही काय आशीर्वाद द्यायचे? बाबांचा आशीर्वाद द्यायचे.
आता मग देताना करा
आता हां
कधी बी येते.
बाबांचा आशीर्वाद घ्यायचे.
बाबांच्या पाया पडा.
काय नाही करत. ऐकलं का?
बाबांच्या पाया. बाबा माहिती
शी डझंट नो एनिथिंग. तुझी तिकडे लघवी तपासलेली होती त्याच्यात तू तिकडे हॉस्पिटलमध्ये गेलीस तिथला दवाखान्यात गेली त्याच्या कागद आहे का नाही तुझं? काहीच नाही. हां
घरी खाजगी काय
आणायला पाहिजे ना काय चिठ्ठी वगैरे. हां
चिठ्ठी घेऊन या.
हां दुसऱ्या वक्ताला काय असं आय एम टेलिंग हर टू ब्रिंग सम prescriptions, you see, or some papers which she had from that hospital. It will give us a clue.
I would give her an episode.
Huh?
It's been so long.
I'll give her ampicillin.
Yeah. Or Kathleen.
Caflex is good.
Oh, that would be best.
This thing, it's good. I don't use it because I don't know any of these drugs.
But she's had it for such a long time, that's what I'm saying. It might be a chronic or subacute bowel
But
nephritis.
definitely it is a chronic condition.
Yeah, I would.
Well, why, the latest stuff that I've read is.
तू लघवी तपासून येईल का? लघवी तपासून येईल नगरला का एक बाटली एक स्वच्छ बाटली घ्यायची. हां तुझा नवरा आहे का? डोंगरगावचा. इकडे माणसं इकडे या इकडे. तुम्ही त्यांचे माणसं आहे ना? इकडे या. See, her husband has come, so we can get more history from him. See, it's very difficult.
Our cousin tried himself in the doctor's either Daction or Septra. This is one of the most popular ways to treat.
That also I use it. Yes.
Yeah, well, this is recommended. One person will recommend it.
After the acute phase.
We give this Sinostat, which contains trimethoprim and sulfamethoxazole. It's a BD dose. This is better to give than the QID dose, no? Because it's for them, see, it's easier to take twice a day than 4 times a day.
I assume those for the acute phase.
We'll have to look that up. That's chronic. Here I think no. Once double strength for 14 days. Something like that.
हे बाबा हे लघवीच्यासाठी घ्यायचं तुला. समजली का? सकाळी संध्याकाळी 2 टाइम बराबर घ्यायचं तरच तुझं दुखणं जाईल. ऐकलं? तुम्ही कोणत्या दवाखान्यात त्याला नेलं होतं? वांबोळीला होतं का? दगडी दवाखान्यात होतं ना? कोण काय रोग झाला होता ते सांगितलं तुम्हाला? लघवी तपासलेली होती. काय बोलले? काय मग काय बोलले ते लोक? मला माहिती नाही काय? त्यांच्या जुने कागद आणा ना. त्यांच्या लघवीचं झालेलं आहे. समजले का? हे औषध देते ते घ्यायचे. सकाळी संध्याकाळी द्यायचे. हां हे सगळी जोडी गोळी खायची. हां हे जोडी हे लघवीच्यासाठी. हे दुखत होतं त्याच्यासाठी आणि शक्तीची गोळी. 3 गोळी सकाळी दुपारी संध्याकाळी असं 3 टाइम खायचं. ऐकलं ना? आणि तिथं जाऊन एक सुई घ्या. तिकडे जाऊन तिकडे दाखवा.
कधी आहे?
तुम्हाला कसं वाटतं? बरं वाटलं तर मग परत मंगळवारी या. 8 दिवसाचं औषध दिलेलं आहे. बरं नाही वाटलं तर मग गुरुवारी परत. हां समजली का? For 8 days, for 6 days. I've given a treatment for 6 days. Yes. I said if you don't feel better, you come back on Thursday. If not, then come back next week, next Tuesday. What do you say?
probably need treatment for a long period of time.
Yes.
It's,
So, no, but I'm telling the husband to send, to take her urine into town for examination. This is the husband.
do they do culture or do they do just examination?
Just the examination for culture, you have to catheterize the urine.
They do what?
You'll have to catheterize the urine. If they are very dirty, they won't be able to collect it in a clean way. Can't be, दुसरीचा भी औषध मिळलेलं आहे. औषध आहे त्याचं. Unless she comes here and then I collect the urine.
He's been sick so long,
He looks very ill.
Like we would naturally see that the state kidneys were in there by an X-ray. A little dye in the kidney. Because she has chronic pile.
I can send her into town if the husband is willing. And that doesn't matter, we can spend from the clinic if it's definitely indicated. We'll do it. But the husband must be willing to do it. Do you want me to do it?
Well, you see how she does. Just to establish that she does have infection. But if she has an infection...
But if she has the infection, that means a culture should be done.
Then you have to wait a few days off the antibiotics to get a culture. You can't get a culture. The thing to do is to get it, I would go ahead and get that.
Leela Bhai Jadhav.
Just get it, and have it start with it.
जय बाबा. काय आता पोटाशी आहे ना? काय त्रास आहे?
जळकी लागते, वांटे होते.
अजून वांते होते? लघवी करून आली? हो. लघवी करून आली? तिथं डोकं कर, तिथं पाय कर.
आता 7व्या महिन्यात लागला. हे होतं खोकला खोकला आला तर खोकला होतो. होय, मग नुसती वाढली होती आणि मळमळ होती. माझी जळकी लागली, मग खावतच आणि पैसे होतच नाही.
It's a big bladder.
You can listen to the people. खोकला येतो.
The doctor.
You won't mind it, only the pelvic examinations they won't allow that.
Is this your first visit?
No.
Yeah, I want to.
तुझं नाव काय आहे? लीलाबाई.
हो, लीलाबाई.
She's complaining of cough. किती दिवस झाले खोकला येतो बाई?
8 दिवस झाले, गेल्या हप्त्यात आलते बाई.
8 दिवस झाले?
होय. 8-10 दिवस झाले.
ताप येती?
नाही, जरा डोकं दुखत, मळमळ होती, वांट्या.
वांत्या कधी होते?
वांट्या ना खोकला आला का मग.
You rarely get a case of preeclampsia or toxemia.
So he's finished?
Very rare.
So he's finished?
In all the last 10 or 12 years, I have had only one case of preeclampsia and one of toxemia.
What you use?
Go ahead. I just can't. You got more?
I couldn't use it.
I've got only 3 cases. Doctor finished?
What
Are there
should I
any
do?
cases?
You know, I had filled up that 2 chloroplasts. What should I do with it? Put it in the refrigerator?
No, throw it out.
No, I couldn't hear any fetal sounds, but I'm so used to using the Doppler.
What's that?
The Doppler is it's like a
Something which
ultrasonic.
magnifies.
Yeah. It's a stereo. And then you have a speaker.
You have got everything so sophisticated then. I feel I hear it just with an ordinary stethoscope. And then you all have something like you take this scanning, do that scanning.
I mean an ultrasound. Then you can see the fetal heart. You can see the baby move. You can actually tell the age by the diameter of the head. She's how many weeks? 35, 34?
They will never know. We have to do it. She's about 2 fingers above the umbilicus. She must be more than 7 months now. किती महिने झाले तुझ्या हिसाबाने बाई?
7वं लागलं बाई.
No, she's just 7 months complete.
25 तारखेपासून 7वं लागलं.
लक्ष्मी मानेक जी ने